Hi, this is a follow-on video from the one I did about mouth taping, where I talk about all the reasons why I think mouth taping probably isn't the right thing to do, although there are some situations where it does help. But what I did notice is that afterwards I had loads of comments in the comment section of that video where people were saying, well, what about nasal pillows, using CPAP through nasal masks and things like that, and using mouth tape to stop the air from going up your nose and then coming straight out through your mouth, and sort of encouraging the air to go down into your throat. So this is a bit of an apology video as such, and I'll be talking a little bit of time about lots of other things in this video as well, just a sort of meandering sort of conversation a little bit. But the idea of this is to explain what I meant by that video. Now, to be clear, I still don't think mouth taping is particularly safe, particularly with people with obstructive sleep apnea. I don't particularly want people with severe obstructive sleep apnea taping their mouth shut. So these people have low oxygen levels at night. If you block off their main way of breathing, if they're really struggling to breathe, that seems dangerous to me. And other things, like some people with obstructive sleep apnea have a blocked nose. And so if you're taping off the mouth and trying desperately to breathe through your nose, well, it doesn't really work that well. And I also worry about people who are using nasal CPAP, taping up their mouth. As Kath Hope said in the comments as well, the lady who runs the charity called Hope to Sleep Charity, she said that what about nasal CPAP having a power cut or something like that, and you've taped your mouth, you've got these things blocking your nose, what's going to happen in those people? Not all people wake up. Now, those are all my worries and my fears and things that I worry about. But there is a video, if you look at, I'll put the video sort of up here, something about moving from face masks to nasal CPAP. I'm sorry, I don't know the exact title, but it's a guy called Nick from CPAP Reviews, an excellent video. Have a look at that, because I think it's really useful, particularly if you're in that situation where you're using CPAP and you're moving from a face mask over to nasal pillows, or if you're actually using nasal pillows already. I think there's a lot of information in that video which helps people understand how to improve their usage of CPAP, particularly nasal CPAP. What did strike me when I watched that video, however, is that I think we're talking about two very different populations when it comes to mouth taping. And I think that's where the confusion for me has been for all my my viewers who watch this channel. You see, my job on the NHS is a surgeon. I am an ENT surgeon by trade, and what I do is I help people who have severe obstructive sleep apnea and snoring, and they've tried CPAP, they've tried a mandibular advanced device, they've tried all sorts of positional devices. It's just not working for them, and they're struggling. They have nowhere else to go. And so they often see me on the NHS, and I try and work out how to get them back to with an operation of some sort to the point where they're breathing normally again at night. Now, that is a very different population to what I think Nick Reviews and all the people in the comment section are talking about. And I think that's where the problem has come on. So there was a paper a long time ago, I think it was Terry Weaver and Ronald that wrote it, which looked at not what trial data for CPAP usage. So a lot of papers, they say, okay, we're going to get you to use CPAP and we're going to get you to use something that is a bit like CPAP. And so these technicians are staring at people all night, making sure they use it all night. That's not real life. What Terry and Weaver, I think it was Terry Weaver and Ronald, maybe I got that paper wrong, but what they found was that just giving people CPAP and saying, look, you've got sleep apnea, use this thing and we'll see how you get on. They found that 15% of people stopped using the CPAP on the first night. So look, I'm just never using that again. After the first week, 50% of people stopped using CPAP. And over the next 2 to 3 years, I think a further 20-30% of people stopped using CPAP and just won't go back to it. Now, those are the bad old days when patients were just, here's your CPAP, get on with it. And if you don't use it, you're going to die. And we're going to take away your driver's license, all that sort of stuff. Fortunately, now things have improved, and there's an awful lot of innovation with the air humidifiers, warmers, different masks, and different settings on the CPAP. So these days, that doesn't happen very much anymore because we look after our patients. Well, I'm not a CPAP person, but the sleep lab in my department, so on the NHS, I work at the Royal National ENT Hospital in central London, and the sleep lab there deals with the CPAP people. So they help them out and they give them advice and slowly improve that. Now, if you look at the paper, I think it was Brian Rottenberg that wrote it. He works in London, Canada, rather than London, UK. And he wrote a paper some years ago now, which showed that despite all these innovations and all the effort that we put into looking after people with CPAP, there's still about 30% of people, so it's a great improvement from, 50% of people stop using it in the first week, but 30% of people still can't really use CPAP despite all of these measures. And that sort of barrier has been going on for many years. But that means 70% of people, the majority of people, can use CPAP if given enough support and guidance and help along the way. And I personally think that's what Nick from Australia in his CPAP Reviews YouTube channel is talking about. These are people who have been given CPAP and they're trying to use it and they're trying to improve their scores, their tolerance of it, so they don't wake up in the middle of the night. So things like using nasal sprays to stop your nose from swelling up with nasal CPAP, using a mouth tape or a chin strap and things like that. All of those things are for people who are trying to use CPAP and they're finding it difficult. It's not for the population that I see. I see people who I cannot use it or will not use it. And they often have multiple problems that makes it very hard for these people, that sort of 30% of people who really just can't get on with CPAP. And it might be because they have multiple problems in their airway. They may have a blocked nose, a twisted nose, big turbinates, big tonsils, say, or a big tongue that falls back. There's all sorts of things that can cause people to struggle and just not be able to get on with CPAP, mandibular advancement devices, tongue retainers, all those sorts of things that we have to help people without them needing to go for the last resort, which is seeing me and having surgery. And that's also the reason I think that in the old days, what we used to do is an operation like a UPPP. That's not a great operation because it may temporarily improve your obstructive sleep apnea for a very short time. But then after a few years, all the symptoms came back and they've had this big operation. It only lasts a few years and they have to start all over again. The main thing about sleep surgery, the reason why it's so hard, is that you need to find out the original baseline problem, the original cause of their obstructive sleep apnea, and start working backwards. A UPPP just papers over the cracks. All you're doing is stiffing up a few tissues and stopping it from snoring so much and stopping it from falling down, blocking off the back of your breathing. That's why it only lasts for a few years, and then everything starts coming back because the palate gets pulled down again. That's why palate operations do not work in the long term for obstructive sleep apnea. They do work ever so slightly for a short time, but not for a long time. They're mostly snoring operations. Anyway, I'm not going to get onto that because I've got videos. I'll try and remember to put one up here. Videos on that topic there. What I'm trying to talk about is go back to mouth taping. I'm really sorry. I said it would be meandering. Now, these patients that I see have multiple problems, blocked nose and throat and all sorts of things. And they need multiple operations to get them back to the point where that we've sorted out the original problem why they have obstructive sleep apnea and all the other problems caused by that original problem. And even as they're getting better, whilst I do these operations, I have to work out how to help them with their weight loss, their insomnia, all sorts of things that may be caused, that's just made them descend into a situation where they can't use CPAP at all. So as you can see, that's a very different population group from the people that Nick is talking about in CPAP Reviews. These are people who are using CPAP and just trying to get things better for themselves. I'm talking about people who are really struggling with anything. I think in those people, using mouth tape can be extraordinarily dangerous. And that's what I really worry about. These are people who are basically maybe very desperate. They're trying to use CPAP and they don't know what to do. They hear about mouth taping. Oh, well, I can't use my CPAP. Let's try mouth taping. That's the last thing I want for these people. But as I said, I've reflected on those comments and what Nick said in his video. There's obviously a really big population of people out there, at least 70% of people who are able to use CPAP, are able to use mouth tape relatively safely. And therefore, my video is more based on people who are either at the very start of their journey, haven't tried any other things, or people who have situations where they tried CPAP, tried all sorts of things, and they're just desperate and they don't really want to go to surgery, which is understandable. It's a horrible last resort situation. And then they try things like mouth taping. So I think my thing is that I realize actually from these videos, the comments and what Nick said in his video, is that I've remembered that obstructive sleep apnea is just lots of different conditions put together. That's how I like to think about it in my mind. It's like saying obstructive sleep apnea is a bit like stomachache. If someone has stomachache, you don't give them all take a take some Gaviscon, or have your appendix taken out, because stomachache can be caused by all sorts of different things. And that's how I like to think of obstructive sleep apnea. Obstructive sleep apnea is not one condition. It's multiple things causing a problem. It's almost like a symptom, obstructive sleep apnea. So yes, two people may have obstructive sleep apnea, but they may have it for completely different reasons. And they may experience it completely differently. That's how I like to see it. I don't see it as one thing. If it was just one condition, then you'd think to yourself, well, there'll be one treatment, one perfect treatment that would work for everyone. And we all know, you can look at all the devices on Amazon and on the internet where everyone is trying to offer, oh, this one solves obstructive sleep apnea. It clearly doesn't solve it, because lots of people have lots of different reasons for getting obstructive sleep apnea. So that's why there are lots of different treatment options for these patients. The skill really is working out which treatment option will work for which patient. They all have obstructive sleep apnea, but there's lots of things that may cause obstructive sleep apnea. So as I said, this is almost like my apology to all those people out there. I was just thinking about the patients that I see, and I apologize to all the other people out there that I've confused, because it must have been confusing, me talking about, look, don't use mouth tape. And then they've been to a sleep center, or they've tried mouth taping with their CPAP and it's worked really well for them. And then Nick's video, which obviously shows that mouth taping is great for some people and it should be used. And also, although I'm just saying sorry as well, I want to say thank you to all those people who made comments in it, and obviously Nick as well for his videos, because I do watch his videos. So those people who have commented in, that does help me. I've often thought that at the start, when I started my YouTube channel in COVID, I thought this would really help patients. And I think it does to an extent. But it's also helped me. And I did a talk for Google or Google YouTube Health some months ago, where I said that I think this YouTube channel has really helped me. I'm going to say it really helped my communication skills, but this video is all over the place. Beside this video, I think YouTube has helped me, because these people are, maybe I'll leave that for the next video. I'm going to come back to this later, because I think I'm straying off topic here. Basically, in the next video, I'll talk about how YouTube has effectively, I think, made me into a slightly better doctor. But I'll talk about that next time. I'm just here to say sorry about that mouth tape video. It's for a slightly different population of people, the people who I tend to see. And hopefully you understand where I'm coming from in this video and that video as well. Do take care. I'll see you in the next one. Bye-bye.